The topic today is family history and high blood pressure. When you go to a doctor, they can ask you if you have a family history of hypertension. What does that mean? Family history means if you have a close relative, like your father, mother, brother, sister, who has had hypertension or high BP before the age of 60. Why does this doctor ask you this question? Do you have a family history? Because if you have a family history of hypertension, your chances of developing hypertension are much higher. If your close relative has hypertension, it does not mean that you have hypertension. It just means that your chances of developing hypertension are much more than an ordinary person. Why is it that if a close relative has hypertension, your chances are more? It is because your genes are the same, your behavior is the same, the environment you lived in is the same. So the question is, what are your chances? If one close relative has hypertension, then your chances are more. But if you have two close relatives with hypertension, mind you, before the age of 60, then your chances double. So how will you prevent this? You've got to prevent yourself from developing hypertension. You can either prevent it or prolong it for a greater period. For this, you have to do lifestyle modifications, your diet, your exercise habits, your sleeping habits, all this come into play. And you have to make sure that you should also avoid smoking, and an unhealthy eating habits should also be avoided. So to an extent, you can prevent or prolong your developing hypertension. So that is the main aim. If there is a family history, that means if there is a close relative, then what with hypertension, and that close relative should have developed hypertension before the age of 60, then your chances are high. If your chances are high, you have to work out ways and means to prevent it or prolong the onset of hypertension. How would you do this? Please make frequent visits to your doctor. By meaning frequent, at least once a year, to find out whether you have developed hypertension. But make sure before that you are following healthy lifestyle, including you should stop smoking, to stop eating unhealthy food. Once a year, get your blood pressure checked up by a doctor, do your lipid profiles, your renal profiles, and if at all you become hypertension, it is mandatory to follow the rules of the doctor. You have to be on medications. If it is not controlled by lifestyle modification, the medicines are not harmful. You have to be regular on medication. Don't titrate it on your own. You should always be under the care of a physician. Once a year would be sufficient to see whether you are a hypertensive. There are various grades of medicines which can be used, and the doctor will choose it for you. Do not be your own doctor. Please seek help. I have just spoken to you about family history and hypertension. We have also discussed how to prevent it or to prolong the onset of hypertension if you have a family history. If you have a family history, it doesn't mean that you will become a hypertensive. It just means that your chances are high. Now, don't worry if you become a hypertensive. There are many drugs which can control your hypertension. Your doctors can prescribe them for you, and you can keep your blood pressure numbers under control. You can add lifestyle modification to your medications. Now, there are different groups of medications. We have the diuretics, we have the angiotensin converting enzymes, we have the angiotensin 2 receptor blockers, we have the calcium channel blockers, you have the beta blockers, we have the renin inhibitors, we have the alpha blockers, we have the alpha beta blockers, and we have centrally acting drugs. We have also vasodilators. Now, I have told you 10 groups of drugs. So you will be wondering which drug you will be using. The doctor has a guideline to choose the drug for you. It depends on your age, it depends on whether you are a diabetic, it depends whether you have an associated heart disease. So multiple factors, multiple comorbidities will come to play a role in choosing your antihypertensive. So all hypertensive patients do not have the same medication. They have different medications. You can discuss your medications with your doctor. He will fill out a prescription for you, which you have to follow. And the timing should be appropriate. If he says once a day, it should always be at the same time. If he says twice a day, give a 12-hour gap and always at the same time. This is a very important. And please be regular in taking your medications. There are small side effects which you can discuss with your doctor, but the side effects of the disease are much more than the side effects of the medication. So the medications have to be taken. And please ensure that your BP is monitored properly by a doctor, and the duration which you take to, the duration in between checking to at least 2 months. Thank you very much for a patient hearing.